Roughly 14 million Americans have chronic obstructive pulmonary disease, or COPD, a lung disease that can make it tough to breathe. Many people live with relentless worry about their next flare-up, which can sometimes lead to hospitalization.
Joining us now to talk about helping patients better manage their disease and potentially reduce the number of flare-ups is pulmonologist Dr. Smith. Thanks for being here.
Thank you so much for having me. It's really a pleasure.
Can you define COPD for us and tell us who it impacts?
Yes, COPD is a lung disease that causes inflammation and damage to the lungs, and that leads patients to feel short of breath. We often think about it as related to patients who are actively smoking, but you could quit smoking for decades and still be susceptible to COPD. There's also a bevy of other environmental factors that can predispose you to COPD, so having a conversation with your doctor is really important. The next thing to know is that COPD is a progressive disease, which means that even on treatment, things can get worse. And so monitoring that you're on the correct treatment and using it appropriately is very important as well. The other thing to know is that there is a lot of patients with COPD out there, and actually it's one of the leading causes of death in the United States. So conversations like this are really important to get the word out about COPD.
Dr. Smith, what are some of the major challenges that COPD patients experience?
We prescribe maintenance inhalers, or inhalers that medications that patients breathe directly into their lungs to calm down the inflammation of COPD. But even if they're taking these correctly and using them as prescribed, patients can experience flare-ups of their symptoms. And these flare-ups not only are inconvenient, but they're also severe. So they can beget more flare-ups and more severe flare-ups and even hospitalization. The more research we do about COPD, we're understanding that it's due to inflammation from a type of white blood cell count called an eosinophil. And we now have a blood test that we can perform in the office, not only to tell us if patients have elevated eosinophils, but are therefore at increased risk of these flare-ups.
Okay, what is the largest development or a development on the horizon that could help COPD patients with flare-ups?
And that's the really exciting part. So biologics for COPD are the new and exciting part of pulmonary medicine. These are medications that can be injected underneath the skin in addition to a patient's inhalers to help calm the inflammation of COPD. Specifically, Nucala or mepolizumab was approved by the FDA recently to combat this inflammation. So it is an add-on maintenance for patients with inadequately controlled COPD and an eosinophilic phenotype. So what does that mean? Patients have to be taking their inhalers as appropriate. They have to have a diagnosis of COPD. They have to be still experiencing flare-ups, and they have to have elevated eosinophils. So the potential side effects, as with any medication, you can have potential side effects, including allergic reactions, anaphylaxis, or even some infections. So talking with your doctor about your pre-existing medical conditions and any side effects you experience is really, really important.
What are some important questions that people living with COPD should be asking their doctors?
I hear some great questions from my patients, things like, am I taking my inhaler appropriately? Is there anything I can do to affect my COPD? How do I deal with triggers or flare-ups, and who do I call? These are all great questions to talk to your doctor about so that we can navigate you through wellness in your COPD journey.
What are the key takeaways you'd like the audience to remember surrounding this topic?
Yes. So I'm here with GSK, number one, and number two is talk to your doctor about your symptoms. These are people who want to help you through your COPD journey and keep you well. And that's really the basis of how to navigate this journey.
All right. Great, incisive information here. Dr. Alexis Smith, we thank you so much for the information. We appreciate it.
Thank you very, very much. Enjoy your day.